Good morning. This is Dr. Timothy Scott here this morning at Life Point Medical. It's March 31st, and I want to say good morning to you. And I want to let you know that we are here for you if you need some help. We want to respond to your needs and try to help you, at least when it comes to medical issues. This morning, I tell you, it's been an interesting morning. I have unfortunately been in the pathway of like maybe at least a dozen patients whose life's been rocked this morning for different reasons, and I just feel like it's worth saying that I really appreciate the life and I want to show gratitude for the many blessings that I've had, and some of my blessings are you. You know, I'm blessed with a lot of patience. I'm blessed with a good community. I'm blessed with a system that's allowed me to operate and legitimately make a good living. And man, it just hold on to your family, okay? Because it's just that simple. Life can change and it can become crazy. So I am blessed beyond my what I deserve, and I beg you to have gratitude for what you have in your life today. It's truly wonderful. Everything we have, it really is. All right, I want to talk about chronic care management. You know, that's a program set up by Medicare here. And what it is it allows us to set up like a membership thing where Medicare patients, we continuously are doing functions set forth by Medicare to monitor your chart, to provide you with the care you need. But yesterday I had a specific incident, and it really brought out the the meaning and the usefulness of the chronic care management. And here's the deal. There's a patient came in, she's a Medicare age, and she needed a medication, and she had called 6 or 7 different places and nobody could respond. Okay, and she needed this medicine, and so she comes to me and she's like, we don't know what to do. This medicine's, we can't get it, and it's just very confusing. So what I did is I had my nurse that I hired, Reagan Beck, to manage my chronic care management patients and to be their concierge. I called her into the room. The patient was able to tell her what the situation was and do everything with me being there too. And Reagan has been working on that since yesterday afternoon in the backgrounds. And that is what chronic care management is about. It's about helping people, Medicare patients, who have complicated, a lot of times not necessarily medical needs, more administrative needs. And trust me, all of these administrative needs were put up by the government. Okay, so now they're giving us a tool to kind of deal with them. And I don't like a lot of them. I don't think they're completely right. But we have to mediate them, and people have to have them. And a lot of times the demand falls on us, so we have a tool set there so we can serve you and we can do what we need to with the Medicare patients. So that's why chronic care management is so good, and I think it's something that you can use if you're Medicare age and you're eligible, which you have to have 2 chronic diseases that are likely to cause long-term effects. We can tell you whether you're eligible or not, but that chronic care management is relatively cheap. I think we get maybe $40 a month per patient. Okay, but we track and monitor our time that we spend on you in between the months, and that's how we do it. So anyway, if we talk to you about chronic care management when you're in the office, remember it's a service set up not by us, by Medicare, to help us serve you better. In general, I think a lot of it, and it does help the patient. It helps me, it helps you, and if it helps you and as a bonus helps me, then I'm all about it. So just letting you know about that chronic care management. All right, as far as COVID-19, 1,468 cases with 38 deaths still listed. So that's up a little bit. No, it's the exact same from yesterday, which is good. I'm happy about that. I was worried, are we in another spike? Now I do have about a half dozen patients who I think are positive and are at home still dealing with the disease, but I'm telling them all, you're the last one to have it here in the community. So maybe I'm right on that, and I hope I am. I still think we got to play the game a little bit with this social distancing, the mask, and the hand sanitizer. But I also want you to spend time with your family and friends, because I think the psychological toll of us not communicating with our brothers and sisters and our family is as bad as or worse than the disease itself. Okay, so as Easter comes up, I want you to love on your family and love yourself. And I think we can be responsible about it, but we still can get together and be with each other. So that's what I think we should do, and just be safe. But I also want you to spend time with your family and your friends during the Easter holiday. Alrighty, we're blessed. I'm blessed. Thank you for listening to me. Give us a call if you need anything. Okay. Have a great day.